We typically have 2, sometimes 3 fellows at any given time. Like most pediatric fellowship programs, our fellows complete at least 12 months of clinical work and then 24 months of research. The clinical work is generally split between Ochsner and Children's Hospital, so most fellows do 6 months at each, and they do either a continuity clinic once a week at either of those 2 hospitals. We have a very large spectrum of patient populations here. It varies greatly between our hospitals, which means we see a great spectrum of disease, everything from congenital HIV and tuberculosis to travel-related infections such as malaria. We have a large patient population of congenital heart problems, which leads to surgical infections in critical care patients, as well as a big cancer population. So we see a lot of complications of neutropenic fever, as well as helping manage bone marrow transplant patients.
So if you have a variety of interests, I would say that this is a great program for you. And also if you're self-motivated, like finding your own way, the support is there.
I think pediatric infectious disease is very unique in that you can sort of pivot your career in many different ways. There isn't just sort of one path to take. What's a beautiful thing about our fellowship program is that it's very much geared towards what your interests are. If you would like to be more research heavy, you can do that. If you would like to focus more on clinical aspects, you can do that.
So our fellowship program is rather small, and I think that means it's intimate. We have a tradition of getting along very well with each other. We have a good group of faculty, about 6 or 7 people at the moment, that actually get along very well and like to spend time together. And I think that reflects in how we work with our fellows. It just becomes a close, friendly, constructive environment rather than us looking for fellows that are going to do lots of work for us.
It's a warm and friendly atmosphere, and there's an emphasis on both academic curiosity as well as exceptional patient care. Every one of our conferences, everybody in the department always looks forward to it. Every single one of the attendings I've worked with has always emphasized the need to learn, to be curious, and to make sure that we're doing the very best for our patients that we possibly can.
We really look at our fellows as junior colleagues in our practice. You are not here to work for us, you're here to learn and work with us. That means our program is not fellow dependent in terms of the clinical services. That gives you, the fellow, flexibility in your scheduling, and you don't have to work around the needs of the attendings and where they need fellowship clinical coverage.
The program's culture I found to be very, honestly, family-like, very supportive. There were frequent conferences, learning opportunities, journal clubs, etc., and yet hands-off enough to allow me to choose my own path. The support was great. I was always able to find the help I needed when I asked for it, but I was also able to sort of find my own way, make my own mistakes, but learn a lot by doing it that way.
The perfect fellowship applicant for us is someone who has a passion for infectious disease. We're not necessarily looking for the next great academician. We, of course, appreciate that, but we also have a lot of fellows that want to go into private practice, and we've had great deal of success training people for both areas.
And of course, New Orleans is an amazing, beautiful city and one of the best places in the world to live.
New Orleans is also a wonderful place to live and to work, with great restaurants, a lot of collegiality among not only our pediatric infectious disease faculty, but all of the pediatric and adult and surgical faculty here. And it doesn't snow.
New Orleans is my favorite city in the whole world, so living there for 3 years was the biggest joy for me. I danced in 3 Mardi Gras parades, and I enjoyed the amazing restaurant scene. There's so much in the city it can make your life so much fun. Generally, I would say I lived my best life when I was there.
For all of you who are interested in applying to our program, I certainly encourage you to apply. We look forward to meeting each and every one of you, and I wish you the best of luck in your search. I think the Tulane program has a lot to offer all of you, no matter what you are interested in, because we can offer you training and get you ready for the next step in your career, whether that's a private practice, an academic practice based in the U.S., or a global health practice based either here or overseas. Best of luck to you.